joined. So welcome to the, Sanjana, if I'm not mistaken, the 53rd ZoomIN session of Vasant Vihar And it is quite rightly on a topic which is hot right now. I would like to say that this is
Please unmute yourself, Raj. Dr. Harsh, please unmute yourself.
Yeah.
Dr. Bagai, please unmute yourself.
Yeah, actually, this is a process that we follow, that in order to make sure that people who join don't start speaking as they join, so we mute everyone. Okay, good. Thank you, Sanjana, for that. So as I was saying, today's program is actually a special edition of our ZoomIN. We normally have these on Wednesdays, but going by the surge or upsurge in the COVID cases, all India and particularly also in Delhi, General Prasad suggested that we should have this special program, and without any delay, we have fixed up, and we are very happy that Dr. Bagai and Dr. Mahajan have agreed to do this at short notice. And so I will very quickly, let me introduce the two panelists, and then I will request our two presidents to speak. So first of all, Professor Dr. Sanjeev Bagai, internationally acclaimed senior consultant, pediatrician, nephrologist, and an astute administrator. He is the recipient of the Padma Shri Presidential Award and Dr. B.C. Roy Presidential Award. He has been awarded an infinite number of awards and accolades. And I'm not going to name all of them because, as I said, we are short on time. He's the chairman of Nephron Clinics New Delhi and has been the CEO, MD, director of numerous leading large corporate hospital chains. He's also a visiting professor to universities in USA and Canada. Dr. Bagai is a pioneer in digital technology, AI in healthcare, and has created some of its finest and technologically advanced medical institutions. He has a series of publications in his name and contributes as editorial to many medical publications. He's a thought leader, innovator, and visionary in healthcare and teaching. He has rendered relentless service to India to spread public awareness on the COVID-19 pandemic, and which is why he is one of the most sought after faces and credible voices on every national and international media and TV. And that's where he's going to be at 8 o'clock today. So that's why we are rushing through today's program. Let me also quickly introduce Dr. Harsh Mahajan, an eminent radiologist who's the founder and managing director of Mahajan Imaging. I think a lot of people know about this, runs a chain of diagnostic centers in Delhi. He set up what would be called India's first MRI center in 1991, which would qualify as a startup in today's parlance, since it was started even before AIIMS and PGI or other large hospitals had an MRI. He's a pioneer in the field of imaging in India, credited with bringing many new technologies into the country. He's a postgraduate teacher and examiner and travels widely to deliver lectures on clinical applications of latest cutting-edge technologies. Mahajan Imaging is unique in that it straddles all healthcare delivery systems in India. They have the distinction of being of service to several presidents and prime ministers, top corporate honchos, and at the same time, the poorest of poor with concessional and free scans. They have an ethos of helping the underprivileged with the affording patients subsidizing the poor. So don't mind paying that little extra when you go to Mahajan Imaging, because it's going towards paying for the imaging of the poor. Dr. Mahajan has also received many accolades and awards, including the Padma Shri in 2002. He's an active social worker associated with several NGOs, chairman of Tamanna, which runs free schools for autistic and multiply challenged children, is a trustee of Rotary Gift of Life Trust, which provides free cardiac surgery to poor children, and has been on the board of governors of Sri Ram College of Commerce, Delhi Public School, Automobile Association of Upper India, and on the board of directors of Punjab National and Indian Overseas Banks. So very rapid introduction. My apologies for that fast introduction, but I'm now going to invite Gurpreet Bindra, the president of Vasant Vihar Welfare Association, the man who has spearheaded the the activity in Vasant Vihar on keeping Vasant Viharis either protected from COVID or receiving whatever medical attention was necessary and required. Pete, welcome and request you to say a few words.
Good evening, everyone. When this lockdown came on the 23rd of March last year, it caught everyone by surprise. And we had an emergency meeting of our office bearers on Zoom. And two things were very clear. Number one, that the government is going to administer the pandemic, just as it is doing with the vaccination just now. They are going to decide how many days of quarantine, isolation, and what are the contact tracing rules, etc. That was all done by the government. They are now doing it in the case of vaccination, that which age groups are going to get it, which working groups are going to get it. So that was a function where we had no role to play except to cooperate with the administration in executing them. The second thing that became very clear was that in case someone got infected, which was bound to happen, we were not medical people. This was a job for the doctors to decide that do you want to give plasma, do you want to give remdesivir, do you want to put the patient on a ventilator, what the virus was all about. This was something for the epidemiologists and the virologists to consider. So we would assist them. So our basic role that we defined at that point was to ensure that our residents, their lives were made as comfortable as possible, give them all the relevant information that we could, and that is basically our role, which we defined and which we have been doing. Now, the first thing that happened was that on day one of the lockdown on the 24th of March, we found that there were 2 mother dairies open in Vasant Vihar, which were totally inadequate to give us vegetables and fruit for the whole colony. We took the matter up with the police, we took it up with the SDM. We got permission that the regular fruit and vegetable people would be allowed to work provided VVWA authorized them. We did that. We got their curfew passes so that they could go to the mandis and buy the stuff. Then, even though there was a lockdown, the houses would still function. You would still have plumbing issues, you would have electrical issues. March, you would need to get your ACs.
Mr. Bindra, sorry to interrupt. I know we would love to hear more about this, but we have I think time pressure for Dr. Bagai here.
Just give me a time. Just give me how many minutes?
Maybe take another minute or maybe minute and a half. Go ahead.
Okay, then, the playbook came and everything came. Obviously, the press said we did a good job. The Washington Post capped it, TV, we were invited for TV shows, so obviously we did the right thing. But today, let me tell you that I have just got the report 10 minutes ago. We have 7,897 cases in Delhi, and the positivity has shot up to 10.21. So this is serious business.
Yeah, Gurpreet, may I just interject for a moment? You and I should stay on the show for longer time. Let the doctors finish the bit. Let them go away because they have some commitments.
Okay, I'll take a minute because there are 3.
Yeah, but we will come back to you if you don't mind.
To focus on.
We will come back to it. We will discuss it.
No, we can come back to this. There are 3 points I want to bring to their notice because I think those are questions that everyone asks us and they should reply. Number 1 is that there is now a bit of a doubt that the government says that Covishield second dose should be 6 to 8 weeks. Adar Poonawalla says 2.5 to 3 months. What do the doctors feel is the correct period? This is a question that gets asked repeatedly. The second is that now people are saying, what is the effectiveness of the vaccination? Earlier on, people thought ki vaccination ho gaya, so that is the end of it. But now vaccinated cases, Gangaram, All India Institute, they're getting it. So what is the effect of this on the treatment and on the incidence? That's the second question we are asked. And the third is, there is this raging controversy going on all over the world about this blood clotting in in Covishield. So these are three things that let them educate us on.
Yeah, thank you very much,
Amongst
Mr.
other
Bindra.
things
Actually, you have preempted some of the questions that I was anyway going to ask. So yes, those questions will be answered. General Prasad, you want to say? You're mute, right? So you're mute right now. General Prasad, you're mute.
Yeah, no, what I was saying was that Gurpreet and I can come back on this program again, but let's hear the doctors, which is the primary objective of today's Zoom session. Let's hear them because they've got shortage of time. And
Yeah.
Gurpreet and I and rest of the Vasant Viharis who are on the show can continue to stay. We will discuss many issues as they come along.
Yeah. Okay. So without further ado, I'm going to kick off some very fundamental questions, Dr. Bagai and Dr. Mahajan. So everybody is wondering why is this second wave occurring? What has caused this sudden sharp incline in the graph? And what are the implications of this? So Dr. Bagai, who wants to go first?
Sanjeev, you go first.
Okay. Good evening, everyone. We'll keep Harsh and me, we'll keep our answers brief and to the point, and as specific and as accurate medically as possible. The second wave is actually a mixture of 2 or 3 things which have happened simultaneously. Historically, if you look at most of the pandemics, especially the respiratory pandemics, the second wave is always more severe, more prolonged, more lethal, more invasive, and with higher mortality and morbidity. It's happened 100 years back. It's happened recently in US, which is still raging. In European Union, most of it is still raging. In fact, countries like France and certain states in US are declaring it the third and the fourth wave. Coming to India per se, specifically, I think it's a complete irresponsible behavior of society at large. And it's a poor example of politicians to be having political rallies, which are a burning volcano waiting to erupt, be it social gatherings, weddings, religious gatherings. These are a big no-no. These are all designated ammunition factories as far as I'm concerned, and super spreader events which are going to spread the virus. The second very important point of the second wave internationally is actually the mutations. And if Raj allows, we can discuss this subsequently during the course of the program. A lot has been said about the mutations. There are different types of mutations. I'll be very happy to explain this in depth, in detail, and what it actually does in the human body inside. And third and very, very importantly is that we have actually forgotten our basics of what we did in 2020. So we have to focus on testing, contact tracing, early treatment, early diagnosis, isolation. And now the phrase of serosurveillance actually is not only limited to antibodies, but genomic sequence serosurveillance too. So I think we are in the midst of a huge storm. We have to buckle up, put our heads down, be extremely careful. And each person, as a responsible citizen, one should become a vaccine ambassador to promote the cause of vaccination because it is safe. There should be no vaccine hesitancy. And two, every person who we talk to should spread the message of the COVID appropriate behavior. And masking is the most important thing if we want to survive this year without any lethal damage. Over, back to you, Raj.
So, since you mentioned the vaccine and Mr. Bindra had raised that issue, there are so many vaccines which have already come out around the world. In India, currently there are 2 which are in vogue, which is Covishield and Covaxin. So what's the difference? And of course, the second question is, what should be the ideal gap? I think the ideal gap is only being asked for, let's say, Covishield. Covaxin is clearly 4 weeks, but Covishield is the one where there is a bit of a doubt. And as luck would have it, a lot of us in Vasant Vihar actually got the Covishield vaccine. So that's a matter of concern. And why should that be a longer gap between the first and second and not 4 weeks?
Let me take this and start from why the longer gap, and then we'll build it up. See, the longer gap actually, while the trials were being done for this Oxford AstraZeneca vaccine, which is Covishield, as it's called in India, they did have some trials, and generally it happens because when you start with a vaccine, you don't know which is the ideal time for a second dose. In fact, you don't even know, like in the Johnson & Johnson vaccine, just one vaccine is able to give you enough coverage. So when they do a trial, they try different doses and they try different intervals and see which is actually working out best, whether one dose is enough. If a booster is needed, then should it be at 4 weeks, which is how generally it has been in the past, or 6, 8, 12. Now, the numbers that they had in the trial for these different time durations were not very large. And frankly, in the UK, when they started and they said that we will take it now at a 12-week interval, they did have some evidence, but not very great. But it was more from the point of view that the pandemic was raging in the UK at that time. Their health systems had got overwhelmed. People were dying left, right, and center. And so the government, in its wisdom, decided, let's try giving as many people the one shot rather than having some people who are fully vaccinated with a second shot at 4 weeks. Let's try covering as many people as with one shot, because even one shot gave about 60% of efficacy, as had been seen in the previous trial. So that really was the genesis. If UK had not been, in the throes of this huge, wave that overwhelmed them, maybe we would all have been still going with the 4-week pattern. Now, what was seen when they analyzed the data that they had was that you got the best effect and efficacy after giving the vaccine at about 12 weeks. This is when they analyzed 6 weeks was better than 4 weeks, 8 weeks was better than 6 weeks, and 12 weeks was better than 8 weeks. But then do remember that logistically, it's very easy for people to remember 4 weeks or 6 weeks than to remember 12 weeks. Many people may tend to forget. Number two, the immunity levels are going to fall off as time progresses. And even though you get better immunity after 12 weeks, giving the shot second jab at 12 weeks, however, if you're not careful in the interim with COVID appropriate behavior, your chance of getting the infection would be that much higher. So that's where probably now the Indian government has mandated that your second jab of Covishield will be between 6 to 8 weeks. Today, if you want to go at 4 weeks or 5 weeks, you will not be able to find your name approved for the jab. The earliest would be 6 weeks. So this is what went behind this whole, story of Covishield. And
what's your personal recommendation?
My personal recommendation is that I'm telling my friends and those who ask me, get it at 8 weeks, but be very, very careful, because your levels of protection will not be as high in probably that 6 to 8 week period, but you will have better efficacy at the end of the 8 weeks. And the government, I don't know if we were to go at 9 weeks or 10 weeks, whether the government would give us the jab, because they have mandated now 6 to 8 weeks. This is something which we'll know in the days to come. Now, what is the difference between the two vaccines? Covishield is what all of us have had. And we as healthcare workers, we had no choice. We either got Covishield, depending on which center we had to go to. And this was again mandated by the government. And we had our second jab at 4 weeks. And we hope that we are well covered. Now, as far as excuse me, Covaxin goes, the second jab should be taken at 4 weeks. There's no dispute on that. And both the vaccines are good. Whichever you're able to get, you should take it. As Sanjeev has said, there should be no hesitancy. There is, and we will address this issue as we go forward, this issue of blood clots forming predominantly in young women. And we will also see whether these women were on hormonal treatment, on oral contraceptives, which are actually very, very, frequently used in the West, maybe not as much in our part of the world. And we've had healthcare workers and frontline workers who are below 30 years of age, young ladies who had Covishield. And frankly, we've not seen in this country much of these clot formation, the cerebral venous thrombosis and strokes. We've not seen many. One of the reasons could be that we've not looked hard enough. The second reason could be that we don't use as many oral contraceptives in this country. But this is all open to question, and probably in the months to come, we will know more about this. But at the present point of time, irrespective of which vaccine you get, and today you have a choice, but still, both the vaccines are very good. They have 70 to 80% efficacy, and the efficacy of Covishield increases as we increase the duration for the second shot. And frankly, without hesitation, we should go and get it. Even the European Medicines Agency, which has looked at this event very closely, they say that the benefits of the vaccine far outweigh the minimal risks that are there. So, let's not worry about it. Let's get vaccinated as much as possible. Of course, the government has put in place certain criteria and some prioritization, and we are seeing it opening up with time. Personally, if you ask me, I think that has been the correct approach. Those who are more at risk of getting serious disease or dying from the disease or requiring hospitalization have been covered first, and then subsequently they are going down the line, and probably in another few weeks we would even probably go to 30 years or 35 years and be covered. Over to you, Raj.
Dr. Mahajan, other than the possibility of the blood clot, are there any other side effects of this vaccination?
Well, we have very, very rare side effects which have been seen. Of course, the effects we know, that is the fever, a local sore arm, you may have, headache, you may have general myalgia, weakness for a day or two. And the fever can be controlled with the
myalgia को English में बताएंगे?
Myalgia, बदन में दर्द. Yeah.
Some of these, medical terms,
No, I'm sorry. I try not to use medical terms. Some of them are so much in common use that, so this is, aches and pains all over. You may even have joint pains. These are things which are very routine. Yeah. Some of the serious ones, but which is, more like 1 in a million, is that, and that happened in the trial also, and maybe what we call acute transverse myelitis, where you may lose power in your arms or your legs, the lower part of the body, but that's hardly any cases. And also at times there may be hemorrhages or bleeding in different parts of the body. Very, very rare. And this has been seen even with the other vaccines, the messenger RNA vaccines, the Pfizer and the Moderna vaccines, which have been used predominantly in the Western parts of the world. So I would say the benefits of the vaccines far, far, far outweigh the minimal risks of a serious side effect.
So, you use the word efficacy or efficiency of the vaccination several times. Dr. Bagai, can you explain to us what exactly does it mean? And are vaccines generally 100% efficient, or are most vaccines only have an efficacy of 50% and therefore a 70-80% is anyway good enough?
Okay, so for a common person to understand, the two common words which are very commonly used in household is how efficacious is the vaccine. Now, this when you talk in terms of efficacy, in terms of efficiency of a vaccine, this is classically used in a clinical trial mode. So when the vaccine goes through different phases of clinical trials, phase 1, phase 2, phase 3 of clinical human trials, we have two groups. One is a group which is vaccinated, and the second group is a placebo group, which is the non-vaccinated. And then we check in the vaccinated group how many people got infection post-vaccination and how many in the placebo group got. Therefore, there is a 1 minus an odds ratio formula, and we get a percentage which we call as how efficacious the vaccine is, that is vaccine efficiency, what we call as VE. Any vaccine declared by WHO more than 50 to 60% of having a VE, or 50 and 60% and above, is extremely good. In terms of efficacy, these are in a very controlled, very sterilized environment, which is age barred, in which only healthy volunteers come in. Now, what happens in the real world? Once a vaccine is launched and it is used in common public, the vaccine efficiency is calculated not in the same way as efficacy in the clinical trial mode. So when you talk in terms of effectiveness on the ground, when the vaccine is being rolled out in common public use, the effectiveness often is little lower than the vaccine efficiency in a clinical trial mode. The reason is there are environmental factors, genetic factors, different age groups, different medications people are taking, different comorbidities. So both the vaccines within the Indian diaspora, be it Covishield or Covaxin, have a VE of between 66 to 82%. The last one of AstraZeneca is declared as 79%. When you talk in terms of effectiveness on the ground, both of them have shown a very good effectiveness. In fact, most of them have shown effectiveness in this manner. That means it controls the infection between 75 to 85%. It controls serious infections landing up in the ICU up to 90 to 92%. That's the effectiveness. And the most recent examples of preventing death is near 100%. Now, what are the endpoints when you look at a vaccine? No vaccine is 100% safe in terms of no breakthrough infections. If that was the case, we would have eradicated polio a century back, and we won't have seen tuberculosis in India at all. But no vaccine is 100% protective. So you will always see a small percentage of people who come into contact of the infection and which converts into disease. So the end point of these vaccines is it should be safe, easily administrable, it should be accessible and affordable, it should give a maximum benefit in terms of penetration of preventing infection converting into disease, preventing serious cases landing up in the ICU, and preventing death. And fortunately, both these have been shown to have fulfilled all these roles. Mr. Bindra had mentioned there were case examples in All India Institute, in Gangaram, in which a bunch of doctors got. Very quickly, I'll just take 2 minutes, Raj, on this. I'll break it down. 500 odd people in Gangaram, say, for example, got the vaccine. 35 got a breakthrough infection. Only 3 were hospitalized, no deaths. That means it had a 93% protection to prevent hospitalization, 100% protection to prevent deaths. Therefore, the vaccine works. I'll just take the last 1 minute and just take off from where Harsh left off so that we can complete the topic of the side effects as far as the thromboembolic phenomena or the blood clots is concerned. There is no ingredient per se in both the vaccines which is thrombogenic. That means it precipitates. But what really happens is once the inactivated vaccine, which is genetically modified, enters into the body, there are different metabolic cascades, different parts of the body kick in as a response to the vaccine. There are 2 large studies which have been published, one from Germany and one from UK. And the overall percentage of the thromboembolic phenomena as blood clots is 0.000007%. That means it is so rare, it is lesser than 11 per 1 million of general population getting thromboembolic phenomena. They have also done some studies in which they have shown there is a particular protein known as PF5 protein. About 10 to 15% of human beings carry this protein by nature, genetically, which actually precipitates a heparin-induced like reaction, which we now call as VIPIT, which is vaccine-induced thrombotic, prothrombotic immune thrombocytopenia. That means your blood platelets start decreasing. But it is extremely rare. I don't want, very often the media picks up the bad things of the vaccine and doesn't highlight the good things. I want everyone to know that the risk is so low and so minimal that we should always take note of it and investigate it. But it should be highlighted that the vaccines are safe in all age groups. And all these patients which have been analyzed internationally have certain ongoing comorbid conditions which are actually a precipitating factor. There is also some videos which have been going around in the Indian diaspora of getting a CRP done before the blood test. I want to strongly and academically state a pre-vaccination CRP is not required, not mandatory, not useful, often misleading. So I want people to get the vaccine done just as walk-in. Do not get worried. You will be safe. You will have certain minor local reactions which are self-limiting, transient, and you will have a good, adequate response post-vaccination. Over to you, Raj.
Talking about
Raj, if I may just
post-vaccine,
add, if I may, sorry, I'm interrupting. If I may just add, just to put things into further context, as far as these, the clotting part is concerned, someone has calculated and said you have a higher chance of dying from lightning twice in one day, okay, as compared to getting a side effect of this vaccine. So that's how very rare, the zeros that Sanjeev counted are real. And also I may say that Covishield, my son and daughter-in-law who are in their early 30s, both of them have had it. And my father, who's 91, he has had it. And touch wood, it has been fine. So again, Sanjeev has highlighted one thing, that something negative happens and the media just picks it up and goes to town about it. And that's where the hesitancy increases. Whereas what we need is more and more of our population to be vaccinated.
fair enough, fair enough.
I raise one question before the doctors have limited time. With your permission, Raj,
Yes,
sorry
sir.
to interrupt you. My question is related to the fact that how many doses are there in one vial? And once it is opened, for how long can it be remaining unopened and its efficacy doesn't go down? And last, what is the storage guidelines for the COVID shield? Because this is what we are dealing with. So when I go to a nursing home or wherever to get a shot, I do not know if it's a new vial been opened for me or how many people have taken and how long has been the waitage between me and the previous one. Can you just elaborate on this, please? Because this causes concern to all of us.
Yeah, I could.
Go ahead, Harsh. Go ahead.
Okay. So the Covishield is a 10 injection vial. So 0.5 ml is what is injected. That is one dose. And this is a vial which has 5 ml in it. And it is to be stored between 2 to 8 degrees. 2 to 8 degrees, which is the kind of temperature that we have in our refrigerators. And once you take it out from the refrigerator and open the vial, it has to be consumed within 4 hours. So that is the underlying thing. And so, if you've gone and got a shot within that 4-hour period of the vial having been opened, that is fine. Covaxin, on the other hand, is a 20 dose, vial. And I don't know the exact time, but I do know it's longer. It is longer than Covishield. So maybe 24 hours. Sanjeev, you know the exact...
8 to 12 hours.
8 to 12 hours.
Once it is outside the refrigerator.
Yeah.
Yes, but the point is that if I go for a vaccination and I do not know when the previous jab took it, 4 hours ago or less or more, then I'm a bit worried because I haven't seen. You see, when the first shots were taken, there were huge crowds. So you knew that it's all getting consumed in a matter of 15, 20 minutes, not even 4 hours. But today, when the crowds are lesser at places, I'm not too sure whether the last filler was 4 hours ago or whether 20 minutes ago. How do I make sure that this vaccine is not going to cause a
Yeah.
negative effect?
So generally, this is on the local logistics of the place where it is being administered. But I think the guidelines are very, very strictly being enforced. Each and every injection is being monitored as far as the data is concerned. Um, uh, I would be reasonably sure to say 99.9% of the hospitals and the centers which are administrating it will take care of the cold chain, will take care of the local logistics, make sure that the wastage is minimal. But I'm sure they will not give a vaccine which will be less potent once the thermo instability comes in.
So I should go and ask him when was the last shot taken and when was this
You can ask, sir. There is no issue with
So
that.
I would even say that, they start the injection at 9 o'clock, go before 1 o'clock, and you'll be in that 4-hour period.
Well, or else go there and wait for 9 people to take before you.
Can I ask a related question, please?
Yeah, Sanjana, you are at liberty as a co-host.
As most of us have actually taken the first dose of the vaccine, and we are talking about the side effect, will the side effect of the second dose be more pronounced than the first dose?
Okay. Yeah. So just let's, Raj, with your permission, you are moderating the show. Just to highlight, why does a reaction happen and what is a reaction? I think it's important for a layman to understand that a reaction to a vaccine is not a bad thing. That means your body is actually responding to it. So please don't get worried in case you have a little bit of fever for a couple, maybe a day and a half or two, and do not get worried in case you have a little bit of body ache, generally feeling weak, or a little bit of muscle pain or joint pain, or indeed local redness or swelling at the site or arm soreness, stiffness, so to say. Once you get the first vaccine on day 13 and beyond, so if you count the first shot on day 1, on day 13 and beyond, your antibody levels start building up. So you have different arms of your immunity. Your first arm of your immunity is the antibodies, which are produced by the B cells in your body. Your second arm is called as your T cells in the body. Generally, the T cells build up into the second to the third week after your first shot is given. Now come to your second shot. Your second shot, as has been explained, initially it was 4 weeks. Now the recommendation is slightly longer. But if you, not from your point of view, but if you look at the data very carefully and scrutinize and analyze it, there are a lot of fallacies in the 12 weeks decision. So my own recommendation is to take it between 6 to 7 weeks, give or take few days. But once you get your second shot, it takes at least 15 to 20 days after your second shot for you to have an adequate level of documental neutralizing antibodies. So antibodies are again of different types. These are proteins. So you take a little bit of 2 weeks beyond the second shot. So you're looking at about end of the second month before you have adequate antibodies. Your T cells are the ones which kick in into the second week, third week after the first. They start reaching a peak at about 2 months to 3 months. And these are the long-lasting warriors in your body. This will last for a better part of 8 to 10 months, even sometimes 12 months. Your T cells are your memory cells with your memory B cells. So these recognize in case you come in contact with the infection and your body will actually host a response. So when you say it's a reaction is an external manifestation of your internal response. It's very much like in the army. Once you know that there is an invader at the border and you are sensitized to that invader, that means you know he's going to misbehave. Your army is ready beforehand, so it will be able to host an adequate response to push the invader out. So your body immunity functions exactly the same way. And apart from that, you have 2 other arms of immunity. One is called as your innate immunity. That's your immunity which your body is born with, a human being is born with. And your last fourth arm of immunity is called as adaptive immunity. Adaptive immunity is as you go along in life, your body cells start reacting to genetic causes, environmental causes, toxins, pollutions, other diseases in which it modulates your body to keep you well protected. So a reaction or a response is a good thing. If your second dose is there, it does not necessarily mean you'll have a more exaggerated response. It can be about the same as your first dose. In fact, you may have a reaction on the first dose and no reaction on the second dose. So each body behaves differently, but do not get worried in case you have fever or body ache or headache. Over to you, Raj.
Very common concern or talk that has been happening nowadays. Is COVID here to stay? Is it something that's going to become like a seasonal flu? I mean, people say it's here to stay, it's not going to go away. So do we have to reconcile to that?
I wish I had a crystal ball, and I could give you an answer which would stand the test of time. Frankly, what one can say is that we don't know. There are many assumptions, presumptions, and the experts of the field have varying views. What it does seem like is that in case we are able to achieve herd immunity, and through a combination of people getting infected and vaccination, that it may reach a level where, it just becomes like a common cold, which comes, bothers you for a few days, and then goes away. But ultimately, it'll all depend on how we are able to, control the surge that is happening. Because what we saw in 1918 to 20 in the pandemic was that, as has been said, the second wave was disastrous. And then there was a third wave, there was a fourth wave. We are already seeing that happening in Europe. And so it's only with time that we will know. But as long as we are protected, at least with this vaccine that is already there, and if the virus mutates as it does, as it won't, it has to survive. And for that, it's very clever. It keeps changing its shape. And some of the mutations may end up, as we know, there are three that are very common, the UK, the South Africa, and the Brazilian strain. And now we are also talking about a strain in Maharashtra, which is the double mutant that we are all hearing about. And if it mutates into something else which escapes the vaccine, like it is said that probably the South African strain would escape. Our indigenous Covishield is not very effective against it, only about 10%, whereas against the UK strain and the Brazilian strain, it is very effective. So this is all in the realm of the future, and only time will tell. But if we keep protecting ourselves through vaccination, and most importantly, it has been highlighted time and time again, the mask can stop any strain. If we follow COVID appropriate behavior, whether it's the original strain, the Chinese strain, or the UK strain, or the South African strain, or the double mutant, you can protect yourself. And this now is borne out. We are nearly 15 months into the pandemic. And even in India, in the last 12 months, the young doctors and nurses who are working in ICUs where you have COVID patients, because of the fact that they were diligent with the masks, with the PPE kits, they've not developed. It's not that in this 1 year of working in ICU, invariably everyone has developed the disease. It hasn't happened. So we have so much with us to protect ourselves. It's just that we've thrown caution to the winds. We've started partying, weddings with 500,000 people, of course, the religious gatherings and the elections, and our, politicians cutting a very sorry figure, I mean, the mask is always below the chin or at the chin, and the mouth and the nose are uncovered. What example are we setting for people in this country? So the government can only do that much. It is for each one of us to protect ourselves.
I want to ask a very different kind of question that, I mean, somebody who has already tested positive, you could isolate him or keep yourself away and protected from him or her. There are so many people who seem to be asymptomatic carriers or pre-symptomatic carriers. Now, what do we do with such people, and how do we remain protected from?
Yeah, so the difficult part of this virus is actually because it's airborne. So when you talk of if it's airborne, the virus can travel right from a distance not only 6 feet, but indoors even up to 20 feet within 3.2 seconds. In case a person is speaking loudly, coughing, or sneezing. I'll repeat it again: 20 feet in approximately 3 seconds in a closed environment which is poorly ventilated in crowded areas. And this can actually spread like binary fission. It's like a volcano which erupts. So keeping this in mind, when you're looking at whether it's a symptomatic versus asymptomatic or pre-symptomatic, so there are different categories. So let's break it down very quickly. Asymptomatic carrier is a person who will carry this infection either in the nasal passage or in the back of your throat, and your body immunity is strong enough, and you will not manifest with any overt infection like symptoms. So you may not have any fever, cold, cough, breathlessness, body ache, joint pains. These are the very dangerous types because it's almost ranging from 40 up to 85% of people can be asymptomatic carriers who are tested positive. Now, that's the reason of contact tracing becomes so important. The second is what we call as pre-symptomatic. So your pre-symptomatic or post-symptomatic are 4 days before you actually develop symptoms. And then you go into the category of what we call as symptomatic, in which you have overt fever, dry cough, hacking cough, breathlessness, headache, and so on. The asymptomatic carriers, Raj and everyone on the link in, are carrying an equal load as the symptomatic carriers. I'll repeat it again. The asymptomatic viral load is the same as the symptomatic viral load. So everyone has to be careful, and your only savior is what we call as the mask. Harsh had just mentioned briefly on the mutations. For everyone's clarification, a mutation takes place in a virus. Viruses always mutate. That's your evolving game of a virus to stay alive in an ever-changing ecosystem in which a virus is exposed to. For them to survive, it has to mutate. It has to change its structure. A mutation means of two types. Either your amino acid in your blockchain gets substituted, so it's called a substitution, or sometimes it gets deleted. That means one goes away and there is no replacement. So it's an empty chair. What this actually does is it changes the structure. It changes the body surface area of the virus surface. It changes the electrical charge density on the surface. And the surface actually has different flower-like, you must have seen in different television shows and different magazines, flower-like tentacles, which in a dormant state remain closed. When these mutations happen, these flower up like a full-blown a flower, and they latch onto your body cells, which we call as ACE receptors. The mutations are what we've seen in UK, which is called as B117, which is the most deadly strain in European Union and in US at the present moment. We've seen the South African strain, which is the most dangerous to have escaped to the neutralizing antibodies. And then you have the Brazilian strain, and you have a lot of other strains. In India, we have documented 770 strains till end of last month. Unfortunately, only 1% of the Indian population who have got the RT-PCR test has got a genomic sequence. So we may be missing a trick or two in that. The double mutation, which Harsh mentioned about, is rampaging in Maharashtra and Bombay. Double mutation means at the same site of the length of the virus, two mutations take place simultaneously. And the ones which have taken place over here are what we call as EK484, and the other one is 352. That's your location of amino acid change. Those become more lethal. So asymptomatic are carrying the equal load. They can be as harmful, and they may spill over to have long-term damage, internal damage, unfortunately, even without knowing. Therefore, keeping a mask on and keeping your COVID appropriate behavior is really the key to survive this year. Over to you, Raj.
Great, great. So, knowing that you have a time limit, I have other questions, but I will keep them for later, and I am sure Dr. Mahajan will stay on the
Just
show
one
and
more
we can ask him.
question. One question for Dr. Bagai before we let him go. If you
Please.
allow me to ask.
No, no, I was going to, take a couple of questions. So, Jan Prasad, go ahead.
I actually feel these are not worth asking, but still it worries me. The paramedics who are administering the injection on us, do they have any special training required for this? Or any paramedic who has been giving other injections like a normal injection is quite competent to do this? Because we find the Prime Minister going to the AIMS only and getting it done, whereas I may go and get it done in any dispensary. So I'm not too sure if there's any special training or special expertise required to administer this particular injection.
Yeah, so just to first tell you what the injection is. This injection is given in your left upper arm, what we call as always an intramuscular. This is an intramuscular injection. It is given at the insertion of your deltoid muscle. So your deltoid muscle is your external part of your rotator cuff on your shoulder. It is given at the upper end. It is given with a fine needle. Normally they use a 24 or a 26 gauge needle. Any doctor can give it, yes. Any nurse can give it, yes. Or any paramedic can give it, yes. Now, in India, we have a great, huge floating population of so-called compounders, helpers. I will strongly recommend against it. If it's not given appropriately, you can actually have a local, more severe reaction in terms of bacterial infection and things. Keeping aseptic precautions is extremely important. Making sure that the syringe is destroyed after it is used is extremely important. When you take the vaccine out from the vial, because it has a rubber cork, to clean it appropriately with spirit, make sure that the precautions are maintained is extremely important. Measuring the dose is also very important. So I think you need an adequately trained person. You don't need a very highly skilled person, but a person must know the game before he gives the shot.
Thank you.
We have more than a dozen questions which have been put on chat, but I'm quickly first going to ask two people who have raised their hand.
I have 5 minutes more, Raj. No problem.
Yeah, I can see that. I'm keeping track of that. Alka Kapoor, you have a question?
Thank you, Raj. Dr. Saab, I just wanted to know if somebody's CRP is high, say 28, could be because of ankylosing spondylitis or rheumatoid. Should they be going for the vaccine?
Yeah, okay. Harsh, if you don't mind, I'll just take a couple of them.
Go ahead.
I'll leave the show to you. There is a huge concept which has been floated around by certain people. I'm not taking any names. They're all good friends. CRP is not required to be checked pre-vaccination and post-vaccination. CRP is an acute phase reaction. It can react in the blood. It's called a C-reactive protein. It can go up for a host of factors: viral, bacterial, long-standing, chronic disease, multi-organ disease. Even with age, your CRP can go up because you have in age what we call as immunoaging. Diabetes have it a little bit higher. Obesity has it higher because it's what we call as adipose inflammatory tissue. So there is a host of reasons why it can go up. In case you have fever, in case you have ongoing overt infection, which is during the time where your vaccine is to be required, I would strongly suggest that get yourself first screened and treated with your local doctor, not a video consultation, but in person, and make sure that we're not missing any other disease. But otherwise, as a routine, a CRP is not required. Please don't get it done. This is not a marker for your blood clots. There is no study to prove it, neither in India nor overseas.
And Doctor, what about D-dimer? Do you suggest that we monitor our D-dimer after a vaccination?
No. So please, I think this is one. This is an important point which I must bring up in every debate which I go. It's a very important thing. Now there are 18 inflammatory markers which we monitor or are available to be monitored after a person gets infection. A routine infection, which is asymptomatic, who's in home isolation, in fact, does not require any clinical biomarkers to be tested for. The biomarkers are basically one, an immediate information tool, and two, a predictive tool, which includes not only D-dimer, but ferritin, LDH, PT-PTDK, INR, interleukin-6, interleukin-12, and so on. There are 18 of them, which tell us how severe the disease is and how severe you are predisposed to blood clots because of the disease. So I'll come back to your question now. Your inflammatory biomarkers are to monitor and predict the course of a disease after you've got a significant attack of a disease. This is not a predictive test or a diagnostic test pre or post vaccination.
Thank you. Thank you.
Trevan Pal.
And also these Raj, these tests are reasonably expensive. I don't want anyone to fall into a mental trap that because so-and-so got it done, I need to get the full battery of tests done. Please go, keep your medicine simple, keep your approach simple, keep your hands clean and your mouth shut and your nose covered with a mask. Please go ahead.
Thank you.
Yeah, Trevan Pal.
Thank you, sir. Distinguished doctors, I'm logged in from Europe. My mother of 89 years old is living in Delhi, Vasant Vihar. She suffers a bit from Parkinsonia and has had recently a knee operation. Following that, the doctors diagnosed in Delhi, perhaps also blood clot. She's been treated for that. Excuse me to put you on the spot. I'm very concerned, but how would one, in the spirit of what you explained to the previous seeker of answers, how would one go about making an evaluation of the safety for her to get vaccinated, please?
Yes.
I don't know the roadmap to follow.
Yeah, just a minute more and then Harsh, I'll leave it to you. I think Parkinsonism is not a contraindication. It's safe to go ahead. My own father has got advanced level of Parkinsonism. I've given the vaccine to him. It doesn't interfere with any of the dopamine receptors. It doesn't interfere with any of the medication. With regards to the knee surgery, post-operatively, no issue, it's safe to take. With regards to the age of 89, it's even more reason that the vaccine should be given. There are two independent factors. This has been published by JAMA, Journal of American Medical Association, 3 days back, as recent as 3 days back. The two most independent factors of morbidity in COVID, one is age and the second is hypertension. Point number 3 is immunocompromised patients, patients who are solid organ tumors, blood cancers, on chemotherapy, radiation, post-operative for oncosurgery. So these are the more vulnerable. But for Parkinsonism, knee surgery, age, must give it. I will beg your leave. Thank you, Raj. Thank you, General Saab. Thank you, Bindraji.
Dr. Bagai, thank you so much.
It's always a pleasure.
I'm sure we will
And
ask you some other time.
Thank you, Harsh, for coming in. I'll see you later. God bless everyone. Please keep.
Dr. Mahajan stays on the.
I'm here, sir.
Dr. Bagai, thank you so much, and we'll see you again. All right, so let me now take the other questions that people have typed on the chat. Could you please explain the issue of blood clots forming as of, no, I think Trevan Pal's question has already been asked. So, Trevan, is that right? That question that you asked is already there. Ritu Kalra says, as more research has been done on Covishield internationally, is it not better to take Covishield over Covaxin? Should one get D-dimer? I think this question has been answered. Is this vaccine safe for lactating mothers?
See, that's a question which is open still, because lactating mothers were not actually included in the trial, which is natural. So at the present point of time, these lactating mothers are excluded from taking the vaccine. And once the trials are conducted in them, that's the time when they will be included, lactating mothers and also pregnant ladies.
Somebody by the name Ashok, I don't know if that is Mr. Ashok Mehta, he has asked, will you develop spike S antibodies after first dose, say 4 weeks post-dose? What happens if no antibodies develop after first dose? I think in part that question was answered by Dr.
Yeah,
Bagai.
actually, we don't need to chase, antibodies. There is no recommendation anywhere globally that we should be doing an antibody test after vaccination, the first or even the second, unless there is some reason, medical reason for looking for it. And we do know that the response is very variable. The younger lot have a much better response, form more antibodies, and as we age, the immune response gets muted, and also there is an interpersonal variation, one person as compared to the other. Also, we need to remember that it's not just the antibody response that happens when a vaccine is given. There is also, as Sanjeev had pointed out, there are the memory T cells and the B cells. So there is also a cellular response. And at the present point of time, tests are available only in the research mode for looking at the memory T cells. And so memory T cells at times, we still don't know in the COVID context because the time duration has been so short. But memory T cells at times have memory for a lifetime also. And these are the ones, even when your antibodies, say 6 months down the line, 8 months down the line from vaccination, when antibodies go down to nearly zero in the blood, it's these memory T cells which come into play when an infection occurs, and they then instruct the B cells to form antibodies, and thousands of antibodies are formed, and that's how. So let's not be concerned about the antibodies, because it's not that if you have huge amount of antibodies, you won't get infected. As has been seen, so many of doctors have got infected, and many of them had very robust antibodies and yet got infected. So we need to remember that if the infection occurs, it can occur even in the vaccinated. It protects to a certain extent from getting the infection, but what it protects to a large extent in the 90s is from getting serious infection, from avoiding hospitalization and death. So even if we have someone has antibody level of 10 and someone else has antibody level of 500, both can get infection. So that's where COVID appropriate behavior, and most importantly, the mask is very, very important. A mask which is worn, and not just worn, but which is properly worn.
Yeah.
And it shouldn't be around the chin.
That's important. I think, Vinita, your question on the antibody test is answered here. Also, Reena Dayal, Dr. Bagai answered about CRP.
Yeah, that's there's no medical reason.
If you
for
do
doing
not
that.
have any reaction after jab, are antibodies still being produced? I think that was also answered. Shivan Pal's question already done. Manjula Singh, why are there higher charges for general regular checkups for online consultation? I don't think that's subject of today's topic. I mean,
what I can tell you is that healthcare is the cheapest here in the world, and I don't compare with the West. Even if you compare with Pakistan, Bangladesh, Nepal, and Sri Lanka, our neighbors, they are at least 20-25% more expensive. And online consults, I don't know why they are more expensive. Maybe it takes more time. You end up spending more time. Also, the infrastructure that is there created, but that probably is the reason. I'm a radiologist, so maybe I'm not able to answer that.
You certainly can't do online consultation. So
Thank you.
anyway,
keeps you safe.
Ritu Kalra has asked, do we need to sanitize whatever we get from outside?
That's a question I saw. Yes.
Take a bath after we come from outside. Do these make a big difference?
See,
Maybe of interest.
that's I think a very, very important
Yeah.
question, a very good question, because in the early months of the pandemic, we were so paranoid. In fact, we would bring nothing from outside. I know of households who would keep a packet which came from outside, in the sun for 24 hours, 36 hours, sanitize it, then only bring it inside. But now what has been shown, that the infection is more from direct contact. It is more through droplets. It is more through the air. And infection from contact surfaces is minimal. So I don't think there is any need to sanitize everything that comes from
When you
outside.
say minimal, it's not the same as zero.
It is, I would say it is nearly zero. So
Okay.
nothing in medicine
Okay.
is ever 100 or zero. But, it has been exaggerated and we didn't know. But 15 months down the line, uh, unless someone has actually spat on a table and your hand touches it and then you touch your mouth or your nose or eye, the chance of that is minimal. So, and also this fact, maybe for healthcare workers who are working in a COVID ward, working in a COVID ICU, when they come back home, for them to take off their clothes and have them washed separately, maybe that's still prudent. But for the population at large, there is really no need.
The
Raj,
next question that I see on chat, somebody has asked, my father, who's 89, got COVID infection 1 month after the vaccine. I mean, I know of 60-year-old also who has got infection after first dose. When can he take his second dose of vaccine?
That's a good question. That's a very good question.
Yeah.
It is now recommended that after you've recovered from COVID, you should take the jab 3 months from that. 3 months from that time. That is what the current recommendation is.
Okay.
Raj, if most of the questions have been answered, I think we promised Mr. Bindra to have some.
Yeah, of course. There are just, I think, 2-3 more questions. Let me just finish. Aparna Dhawan says, do you recommend any vitamin minerals that we should be taking in order to keep our immunity high? Some say vitamin D, zinc, but it would be good to hear your opinion. I think that's the last question.
Yeah, I think everyone knows this. Your vitamin D level should be in the normal range. You don't want to have, excessive vitamin D in your body. That can also harm. And then zinc and vitamin C. Again, it's not that we need to take them every day. It should be such that, our levels should be normal. And of course, having good food, less of the drink, all of those general things, and the haldi and the tulsi, all of those are very, very good. And I'm no expert on this. Probably on this show there'll be more people who will be able to give a better idea. But let's not do excess of the vitamins,
right,
because some of them can harm.
Fair enough. Unless there is any other question, I would like to once again
Raj, I have a question, Raj.
Yeah, surely. Go ahead.
Dr. Mahajan, you have been emphasizing a lot about masking. So tell us a little bit about what is the right type of mask one should be using, because there are so many different variants. So please tell us more about that.
Yes. So there are basically, if we look at the large picture, there are 3 kinds of masks. One are the cloth masks, which have the least, efficacy. Mm-hmm. Then we have the surgical mask, these blue masks, which you see, and they are at least 3-ply masks. And the third that you have is the N95 mask. Now, the best that we have today, and there's no dearth of these in the country now because they are being manufactured here, are the N95 masks. So if you are to go into a crowded area where you know that there's going to be a lot of crowd and social distancing may not be possible, the ideal is a N95 mask. All the surgical mask as well as the N95 mask they have a dual, and even the cloth mask, they have a dual function. One, you protect yourself. Two, you protect the person who's opposite you. If I'm wearing even a surgical mask, then I'm protecting the person sitting opposite me 90 to 95%. That's how essential it is for the person across you, especially in a closed space, to be wearing a mask. It is tremendous protection. And as far as your own protection, it is said that the cloth masks protect about 50%. The surgical masks protect about 70%. And the N95, as the name itself suggests, protects you 95%. But again, they have to be worn properly. When you wear the N95 mask, just squeeze it from the nose so that, you know, it does have either a metal clip or there is a plastic clip which is sewn into the mask, so that, you know, you're not, the air is not escaping from the sides. But equally important is the person opposite you should be wearing a mask. So this, you know, in short, is what I can tell you.
Thank you very much.
Yeah. General Prasad,
The combination of two.
Before we
And then
go to
95 and a
Mr.
surgical
Vindra a
mask.
chance to speak.
Yeah, Mr. Bindra.
Does that work?
Yeah, Mr. Bindra.
Does a combination of two masks that I use, surgical mask and an N95, does that work?
Sir, we are losing you. Could you repeat your question?
Yeah, Mr. Bindra, repeat.
I use a combination of a surgical mask and an N95. I staple the surgical mask onto the N95. Does that work?
Sir, don't staple it. Two masks work better than one mask. And frankly, when I go into a COVID environment, I also do what you're doing. Of course, there's no need to staple it because you may actually injure the mask. You may cause, you know, the staple may actually create a passage for the virus. Virus, as you know, is a few hundred microns. And so N95 mask to be worn first, and over that a surgical mask to be worn. Two masks work better than one. And what you're doing is the ideal combination. Kindly don't staple it.
You know, the problem I have is my turban. I can't wear a surgical mask with my turban. That's why I staple it.
Sir, what you get N95 masks which have bands which go to the back.
Okay.
Use that, sir. Those are available in the market.
What about a face shield? Is that a good second level?
No.
A face shield, sir, my own personal opinion is a face shield is useful in a COVID environment, in a COVID ward, where you know that these are COVID patients and they may be coughing, there may be droplets in the air. In the general population, I think a face shield is an overkill. Of course, it does protect the eyes. Most of us who wear glasses, our eyes are protected from that. But predominantly, it is the nose and the mouth through which we are catching the infection. So I've frankly, in my centers, I've never worn a face shield.
Yeah, Mr. Bindra, something more?
Nothing.
So if Gurpreet Bindra has nothing more to say, unless Raj, you have to say something. All what I need to say is thank you so much, Doctor.
No, I did want to talk about what we are doing and what we wanted to do, but where Dr. Mahajan was there, I didn't have any question. That was what I meant. I think people need to be reassured in this colony that BVWA is doing what needs to be done and we are with them. So I just wanted to talk 2-3 minutes on that.
Then maybe I can take leave, sir. I can take your leave.
Yeah.
Okay.
Thank you very much, Dr. Mahajan. It's been it's a pleasure, and you have been very.
He wants to listen to what I'm going to say.
Yeah, sure.
But Raj, can I ask a question?
Ma'am, you are the chairman. Please go ahead.
That is not.
Chairman Emeritus.
Good evening, Doctor. I joined late. Maybe you answered this question. Why are so many people getting these second infections? You know, they have, even those who have had COVID injections, they are saying they've had 2 doses and all. And yet so many of them are falling ill, especially doctors and healthcare workers. Is there an explanation for it?
There's a very clear explanation, ma'am. Point number one, the vaccine protects you, but doesn't protect you 100%. So you have to still be careful. And as we know, it's about 70 to 80%. So even by definition, 20 to 30% can and will get infected unless you are careful. That's point number one. Point number two is that people have been, and I speak for my own, fraternity of doctors as well. I mean, they have got it because they were chatting and having chai and food, sitting in the consultants combine. And this is, somehow we've let our guard down. And what the vaccine does, and I want to reiterate, is that it prevents you nearly 100% from getting a serious disease, from having you be admitted in a hospital unless you have other comorbidities, and certainly from preventing death. So that's a huge, huge plus.
Yeah,
and
that's a huge plus, no doubt about that.
We are talking 70 to 80%, efficacy, whereas with the previous vaccines that we've had, especially the flu vaccine, which also causes hundreds of thousands of deaths a year, it is barely 60%. So, and we've been taking it readily over the years. So we have to still follow COVID appropriate behavior, which sadly most of us had given up on. And that's why this has come back to bite us. Today, if you see, Delhi's positivity rate is above 10%. Above 10%.
10.21% today.
Yeah, 10.1%. And we had gone down to nearly 0.025. I mean, 0.25. Sorry, 0.25.
And we have 39 deaths in Delhi today.
Yes.
And we have 7,897 cases.
Absolutely. And private hospitals don't have beds.
I think everyone now needs to wake up. The slumber time is over. These fits are going to get worse. They're not going to improve in the long run. I mean, it's very obvious that they
even in the short term, sir, even in the short term, every day we are seeing numbers gallop.
Yes.
If I may say, Mrs. Chib, आपके प्रश्न का उत्तर एक अक्षर में या एक लफ्ज में है, लापरवाही. That's what the doctors were saying. It is laparwahi that's leading to this.
I agree with you, Raj. But what can you do? I mean, like you pointed out.
What you can do is to, be careful. I mean, the things.
I am being careful, but
I'm
others.
Not referring to you, but
people are not being careful. Everyone, like Dr. Mahajan said, they are partying and they are going and they are having tea and coffee and whatever it is. So that's what's leading to infections.
One interesting observation is that this second wave is actually getting the younger lot more, the 35 to 45, because they are the ones who are now going out and partying or whatever they are doing. So they are the ones who are letting their guard down.
Let me tell you an interesting statistic. Get the ICMR reports.
Mr. Bindra, I will just interrupt you 1 minute.
Out whatever data pertains to Vasant Vihar, and I have the list in front of me. If you look at one observation, if there is one case in a family, within the next 2 days, there'll be 3-4 more.
Absolutely. It's affecting more of the
That's a proven fact. We have the statistic. So it is a galloping, the viral infectivity of this mutation is far more lethal than what the first one was. Because when we did the first one, if there was one case in a family, it probably stayed one case. But here, if there is one case in a family, chances are it will not remain. I mean, that is the clear-cut statistic that is there. So one really needs to be careful.
And the other thing may also be that there are mutant strain, actually we are doing so little of genomic testing that we don't, I mean, we are blind to what strain is actually causing it. One, of course, laparwahi is a sure shot fact, but also there may be some strain which is more, contagious, more infectious, which may be causing this surge.
But that is a bigger worry.
Harper is my neighbor, and he has
Raj, I think
view of
Dr.
what he's going to write in the Hindustan Times tomorrow, and it's on the lack of genome testing.
Yeah, Raj, I think we must thank Dr. Harsh Mahajan.
Yeah.
This debate can continue indefinitely. Most of the
We don't need to.
primary questions have been answered. And I think what Mr. Bindra has been saying is precisely what everybody is saying, that we have to be careful ourselves. Nobody can stop it from spreading. We need to wear masks. We need to sanitize our hands, wash them, keep social distancing, stop partying in larger numbers, and all of that, which all of us know. So it is for me to thank Dr. Harsh Mahajan and of course Sanjeev, who's left, for joining us. And thank you, Mr. Bindra, for having been with us as the president of our VV welfare. And I think the Vasant Vihar Welfare Organization is doing a great job in this. We wish you all the best, Gurpreet. Continue to do good work. And we are very appreciative of what you're doing. And I'm sure you will continue to do what you need to do. Thank you so much, everybody. And particularly, I want to thank also Raj Sharma for organizing this show at short notice. And Sanjana Raj are always willing to participate and help us in do these things. Thank you very much, everybody, for joining us. Good night.
You, sir.
Thank you, sir.
Bye-bye. Good night.
Thank you, Dr. Mahajan.
Thank
you.
Good
Good night.
Thank you
Thank
very
you.
much.
Thank you.
Thank you,
Everybody.
viewers.
See you again soon.
Please, thank you, viewers. Stay safe. Please take adequate precaution. And we will see you on Wednesday with the next episode of ZoomIN. Till then, take care, stay safe, stay well.
Thank you, Sanjana. Thank you, everyone.
Bye-bye.
Thank you. Thank you
Thank
very
you.
much. Thank you.
Good night.
Thank you. Thank you.